Hello, I'm Dr. Michael Walker, a facial plastic surgeon. I'd like to address the topic of preventative maintenance of skin care today. As Americans, we have a cultural thing about sun worship, and many of us have spent too much time in the sun as youngsters without protective sunscreen or protective clothing that keeps our skin from getting a lot of ultraviolet damage. We don't typically see the results of that damage until decades afterward, although initially we may have a sunburn. 20, 30, 40 years down the road, those damaged chromosomes will start to replicate and cause basal cell, squamous cell, and carcinomas and melanomas. So the skin care that you do as a youngster or a teenager or even in your 20s will have a significant impact on your development of skin cancers later on. A good portion of my practice is involved with removing skin cancers and reconstructing people's faces after removal of these horribly disfiguring cancers. So, what can you do to prevent from having skin cancer, and what can you do to help your skin look better and keep it nicer looking and younger? Well, as I just mentioned, the first thing is avoidance of the sun. But if you find that you have to get out into the sun, you really need to wear a sunscreen. And at least a rated 20 sunblock is recommended. Anything over 20 is really diminishing returns. With a 20 sunblock, you get 99% blockage of the sun's rays. There are some new sunblocks out which are UVA and UVB blockers. Many of the European sunblocks are UVA and UVB, but only recently have we had some good cosmetic type sunblocks that are UVA and UVB blockers. They're made by a company called Neutrogena, and it's called Ultra Sheer. It's a 45 or a 55 block. It's fairly clear, and when you put it on, it's really not noticeable. If you want your total sunblock, you can always use titanium dioxide, but it has a sort of chalky appearance, and you've seen the kids on the beaches with fluorescent green and fluorescent pink noses. That's generally a titanium dioxide block. So skin care is really enhanced by a block when you're out on the beach or out in the swimming pool. Also, if you wear a wide-brimmed hat to cast a shadow on the face, that's very important too. The second thing that's important is to keep your skin well hydrated and to use some form of moisturizer. I don't have any specific type that I recommend. Most women are already using a moisturizer they've discovered on their own. It enhances the appearance of their skin and prevents it from drying out. So use a moisturizer at least once a day. Now, the chemical that most people are not aware of that causes the dead skin cells to shed off the surface is glycolic acid. Glycolic acid is a derivative of sugar cane. It's commonly known as called alpha hydroxy acid. Alpha hydroxy acids are in a family that's usually found in fruits and some vegetables. Citric acid comes from oranges, lactic acid comes from sour milk, and glycolic acid comes from sugar cane. There's also another group called beta hydroxy acids, which aspirin or salicylate is one of those. Those are sometimes used to help exfoliate the skin and remove these dead skin cells on the surface. By removing these dead skin cells on the surface, the skin has a more clear and useful look to it instead of a sallow, dull look. If you use the glycolic acid cream, it needs to be used at night before you go to bed. Some people can't tolerate glycolic acid because their skin is so sensitive, and those people, we tell them to use it every third night or every other night until they develop a tolerance to the glycolic acid. But if they use the 10% glycolic acid at night and then a moisturizer in the morning, it will really enhance your skin and reverse a lot of the damage that's already occurred. Now, glycolic acid, as I mentioned, is an antioxidant which helps repair those free radicals that are created in the skin from the sun's ultraviolet rays. It scavenges up those free radicals and prevents them from damaging the chromosomes and the DNA. It's also an antioxidant, which is an anti-inflammatory, like aspirin. So if you use glycolic acid, you need to make sure it's a 10% solution. Usually these are only found in doctor's offices or pharmacies. The reason that they let some of the department stores sell cosmeceuticals with glycolic acid in it is such a low concentration. It doesn't have any therapeutic effect, nor does it really have much of a risk of causing a problem. That's why the FDA lets them sell it over the counter. So a 10% solution is recommended. Now, to enhance the effects of that glycolic acid, patients may want to undergo a 50% glycolic acid pill once a month or once every 6 weeks to help speed up the process. This can also be enhanced with an ultrasonic facial. An ultrasound machine dislodges those little epithelial cells on the surface, or using microdermabrasion. That's another way to help exfoliate the skin. A medium or deep pill is another way of completely getting rid of all those epidermal cells and starting the whole process over with a brand new layer of skin, but I won't get into that today. The glycolic acid should be carefully applied around the eyes. The skin around the eyelids is very thin, and you'll see quite an enhancement or improvement of the skin by using the glycolic acid around this thin skin around the crow's feet and the eyes. It's also good to use it on the upper and lower lip, where some people may have developed smoker's lines from either pursing their lips or speaking or chewing. So glycolic acid and sunscreen and moisturizers are the three basic building blocks of skincare. Now, some of the other things you can do, which are more lifestyle changes, of course, are avoiding smoking. And number two is diet. Taking antioxidant vitamins is very important for your skincare. Vitamin A, vitamin C, and vitamin E are all antioxidants and really enhance the skin quality. Another supplement which is very important is fish oil, or omega-3 acids. The fish oils have anti-inflammatory properties. They're also anti-atherosclerotic, anti-Alzheimer's disease, and anti-cancerous. So by taking fish oil 2 to 4 grams a day, you're really going to enhance your skin quality. Another option is to eat a lot of salmon, and make sure that's Pacific West Coast salmon, because the East Coast salmon is usually raised in a farm, or it has a lot of mercury in it, heavy metals. So if you're going to take fish oil, make sure it's a pharmaceutical grade fish oil, USP on the side, and take 2 to 4 grams a day. There's a dermatologist who has a very good book on skin care and nutritional enhancement of the face. His name is Nick Perricone. His book is called The Perricone Cure, or The Wrinkle Cure. The Perricone Prescription, or The Wrinkle Cure by Nick Perricone. He's got a lot of excellent nutraceuticals and diet-related issues that will help you with your skin care.